So coming to my next question for you, sir, how is stress and emotion related to gut health? How are they connected?
They are related in a very, very big way, actually. I mean, and I cannot overemphasize it. I mean, the relationship is very, very close, and they can very, very adversely affect the gut function, basically. Okay. I mean, a major chunk of our the cases that we see in our day-to-day practice is something which falls into a group called functional gastrointestinal disorders. What it essentially means is basically there is no structural or any organic cause for it. So if you do host of investigations, you won't find any cause to it. But people, they tend to be very, very troubled with the symptoms, basically. Okay. And the symptoms can be so bad that, I mean, it can affect their quality of life very, very adversely. It can affect I mean, their work, career, and also there is a huge impact on the healthcare costs as well. And it is basically for both the healthcare and for the person as such. I mean, it can have very, very big implications because the symptoms can be so bad. And and you may have, I mean, you know very well, there's a condition called irritable bowel syndrome. Then there are other conditions like, say, acid reflux disease. Um, some people end up having swallowing difficulties where there is no physical blockage as such in the esophagus, but they end up having swallowing difficulties, constipation, diarrhea, bloating. They are very, very commonly seen, and abdominal pain. They can be sometimes quite difficult to treat, and they cause very, very poor quality of life. And more often than not, there is always an overlay of, say, some psychosocial problems. It could be stress, it could be anxiety, it could be depression, and I mean, and there are a host of other psychosocial problems as well, like relationship problems, career-related problems, and so on. So what happens is, I mean, as I explained in my physiology, that, I mean, there has to be a very, very coordination between the brain and between the gut. When this coordination is broken with anything, then it can cause problems in the abdomen, in the digestive tract, basically. Okay. So because there is always a crosstalk between the gut and the brain. So this crosstalk it goes on involuntarily. So the brain or the central nervous system, and there our gut has got its own nervous system. Okay, they must work in very, very close cooperation. So if we have any conditions like, say, anxiety or depression, okay, or say stress, these things are conveyed to the gut as well. So from brain, it is conveyed to the gut as well. Okay. And when it is conveyed to the gut in a wrong manner, it is bound to cause problems, a host of problems, basically. Okay. And not only it causes functional gastrointestinal disorders, and not only things like IBS, irritable bowel syndrome, and things like that, it can affect there is something we call gut microbiome. These are the good bacteria which are there. It can affect the good bacteria as well. Okay. So there is something we call brain gut axis. So brain gut axis means basically there is a bidirectional communication between the brain and the gut. So it's two ways. Okay. So that means there has to be a very, very fine coordination between the body, between the mind, and between the gut. Okay. So when this is affected, it can affect the gut health adversely. Okay. And there can be multiple things which can affect it. Say, for example, somebody who had, say, bad childhood experience, say they suffered. Hello.
Yes, I can.
Hello. I think I have lost you there, looks like. Yeah, I can hear you now. Yeah.
Yeah, I can hear you.
Okay. So, I mean, say, for example, somebody had like a bad childhood experience. Okay. Say, for example, childhood trauma of any type, say physical, mental, sexual, any type of a bad childhood experience. Okay. So when they grow up, they normally take all those emotions with them when they grow up. Okay. And they continue to have quite a few symptoms in the not only in the digestive tract or in the gut, but elsewhere as well. Okay. So that is one. Or somebody who is very, very stressed for any reason, which may be because of any relationship, business, career, whatever. The people who have got depression, anxiety related, generalized anxiety disorders, these all can affect the gut health. So that's why, and what happens is we as a physicians, the way we are trained, it's basically to find a cause and treat it. So what happens is somebody presents to us with any symptoms, say pain in the abdomen, diarrhea, or a mixture of various symptoms. The first and foremost thing is to investigate and be sure there is nothing organic or nothing physical causing the problems. And many times we don't find anything. But what happens is we are not very well equipped to deal with those sort of patients where there is the problem is mainly because of the psychosocial overlay, because the way we physicians are trained is to find a cause and treat it. But there are many other underlying factors going on which we are not very well equipped to treat. So lifestyle medicine, I mean, one of the reasons I did was I was hoping that it will equip me with few skills that will help me to basically deal with all the other psychosocial elements like stresses, or at least how to deal with them, how to refer to the right team, and so on. So it becomes important not only to identify, not only to ensure there is no underlying cause to it, like any physical cause to it, but at the same time to be able to identify these symptoms or these conditions can be driving the symptoms, and refer them to the right team, or at least give them the right advice on how to deal with them basically. So I mean, the role they play is very, very huge. And not only that, I mean, it's not only in, say, functional gastrointestinal disorders like IBS, but people who have got, say, for example, inflammatory bowel disease, which is like there is a physical cause to it, like, say, ulcerative colitis or Crohn's disease. Stress can make it very difficult to control the inflammation that is going on in the gut. And it can, I mean, it can cause a recurrent flare-ups and things like that. So that's why it becomes more important for people who are already having some condition to ensure it is not precipitated or aggravated by the stress and things like that.
It is such a complex topic, like you said, and stress is like so underrated. Like I think in my practice, like there's not a single person whom I don't have to consult about stress, like irrespective of the reason they come to me with, be it weight loss, be it something related to mental health, be it any other thing, muscle gain and hormonal imbalance, anything. Each of them have some stress factors that they haven't managed well, and the issue is that people are not even aware that that there is something that is not right, that it's not right for our health. Like people are totally unaware about it. So you explained it really well, and I hope more people get to see this video and understand how even gut health is also related to stress and mental health, just like any other physical, like any other organ in our body.
Yeah, I mean, there is so much. What I've explained is only part of it, and only a small percentage of it. I mean, as you said, it's very, very complex, and there is so many things going underneath, and it's so important to tackle. And I'm sure if people know that this is what happens, at least they will seek attention for any stress related symptoms, and at least they will do things what they can to help avoid these problems.
Very true. And like what you just told everyone, sir, about functional gastrointestinal disorders, like there are even people who don't like the etiology is not known, right? The reason behind abdominal pain or the reason behind constipation, etc. The reason is not known to anyone, while it is already there. Like stress is already there, but no one counts it as one of the risk factors or one of the reasons for their GI disorders, right?
Exactly.
There are so many people who suffer with this from this.
Exactly. I mean, if you go back to, sometimes what happens is, unfortunately, in a busy practice, most of the clinicians, they don't have that much of time. But if it is a right professional, and if they have got right time, right amount of time, if you go back and if you can dig through their information, you will find there is something like some life event or some precipitating emotional factor to it, which is driving the symptoms.
it requires quite in-depth consultation with the patient.
Absolutely.
You need
Absolutely.
to give
Yeah.
the patients a lot of time. So thank you so much, sir, for that explanation. So coming to nutrition, so the importance of nutrition, cannot be spoken about enough related to gut health. So can you tell us some tips or some good lifestyle habits for gut health with regards to nutrition that we all can follow, maybe which can be a part of our general diet, like considering the population in general, irrespective of their disease conditions?
Sure. I mean, nutrition, yeah, I mean, this is something like it's a subspecialty in itself. Okay. So, I mean, one can talk all day about it and still we are 1 minute we'll be able to finish because it's so vast of, I mean, a vast of a topic on its own. Okay. So I think I will just touch on few minutes I will take, and I will just touch on the general things, important things that one can incorporate in their day-to-day life as well. Okay. I think what I will do, I will summarize what is a good nutrition in just one sentence. Okay. And that is whole food, plant-based diet. And I think that's all is required. Okay. So as long as people they eat a daily good intake of whole food, whole grains, okay, balanced with right amount of other types of plant source foods like say lentils, pulses, legumes, then vegetables, fruits, I think many of their problems will be taken care of. Okay. The problem is this has got, I mean, changed very, very significantly. This used to be our diet, say, if we go back, say, quite a few decades back, say 4 decades, 5 decades back, say 50 years back, the diet used to be more or less what I have told you just now. But what has happened is, as the life has become faster, more technology has come, we have started processing our foods, okay? So wheat, we take the brown part out of it, and then it's only the refined form left. Okay, so we eat that part of wheat on a daily basis. Okay, or any grain for that matter. Okay, so for any grain, you remove the part of it. Any cereals that are commercially available, I mean, most of the good stuff is removed, and cereals, I mean, we eat, but that is mostly the refined form of it. Okay, we start our day like that. Okay, and then during the day, if we are a busy, say we have got a busy type of life, maybe work, business, whatever, we rely on say fast foods and things like that, or take something very quickly, and then we end up having a meal in the evening which may be of good quality, that is required, good for the body, but not always. Okay, so the more we have started refining our food, the more problematic it has become. And as a result, as a process of refinement, what happens is we are adding few other things in the preparation, which are again not good. Things have become more sugary. Okay, so sugar we are using more and more. Instead of whole grains, we are using very, very refined forms. And animal fat, I mean, it forms, I mean, Western diet, I mean, animal fat, it forms a major part of it. Okay, and animal fat, when I say animal fat, it comes from things like meat, egg, and even milk. Okay, so I mean, any animal source of fat is saturated. Okay, saturated fat is always bound to cause problems. So that in the bottom line is any animal fat, it's bound to cause problems. So previously what happened was, I mean, people used to consume animal fat only say during some community feasts or say family gatherings. So maybe not even twice a month or something like that. So that is acceptable, that is fine. But if it becomes part of your daily routine, you are eating say a few times a week, red meat or say, I mean, full fat milk and things like that, and eventually it is going to cause problems. Okay, so fiber is becoming less and less. Fiber is very, very important component for gut health, and that is becoming less and less. So that means we are refining the food, we are not eating whole foods, we are eating less vegetables, and so we are getting less amount of fiber in the diet. When the fiber is less, it puts one at risk of things like say obesity, diabetes, metabolic syndrome, fatty liver, heart disease, and so on. Okay, and even cancers. Cancers are also on the rise because of more and more, calories from a fat source or from proteins which are from animal source. Okay, so there is higher cancer risk just because of that. Okay, so the key thing here is to avoid refined food and eat more of whole meal, whole grain type of food. So, and also more and more of vegetables so that you get good amount of fiber in the diet. Fiber again are of different types. They are, you need soluble fibers, insoluble fibers. So there are different types of fibers that are required for optimum gut health. So if one is not getting good amount of fibers, not only the diseases I mentioned, but high cholesterol and things like that, high blood pressure, these all things can happen. Okay. So a good mix of fiber, good mix of fruits on a day-to-day basis, whole food, mostly from plant-based. I'm not saying that one should not consume any animal fat or they should not get any calories from animal source, but that should be minimized to as little as possible. So, I mean, that is the bottom line, basically. I mean, if not only from the gut health point of view, say, for example, somebody is eating, say, salads, raw vegetables in salad. Okay. Any raw vegetable that we eat, say, for example, somebody eats a carrot, that it is not only good for gut, but say, for example, for the teeth also, it is very, very good. People are not having good teeth health nowadays because they are relying more and more on sugary stuff and refined food, then they are not good for the teeth as well. Okay, so if somebody is chewing a raw vegetable properly or raw fruit, or a fruit properly, so that not only helps with not only with the gut but also with the mouth health, with the for the health and longevity of teeth as well. I mean, it protects your enamel, it massages your gum, it pours out good amount of saliva. So it becomes important for general health as well.
That is a very good point, which we generally miss, like the oral health and teeth health. It also comes under gastroenterology. People generally
Yeah,
forget. So yeah,
yeah,
that's a very good point. Yes, so
yeah.
you've
But
yes, sir.
it's so vast. I mean, there is a nutrition itself is so vast. I mean, I don't think I've done enough justice because I've told you in a very, very short way or just in few minutes. But I mean, it's so vast. One can spend day talking about it, basically.
Yeah, I know. But sir, in fact, I was going to tell you that you've tried to, briefly summarize everything so well. Mainly what all the audience needs to know, basically, and then whoever is interested can, go into more depths, research some articles, etc. But
Yeah.
whatever you told has basically summarized all the important points, I think. So
Just one point I would like to add here. What happens is we eat more fat from, say, any animal source or any saturated fat or even, say, fried food. Even the not only it, I mean with animal foods, but say things, even vegetables which are, say, fried and things like that. Okay, there is saturated fat in them. Okay, so it is one of the important factors which is nowadays responsible for something called insulin resistance. Insulin resistance is like the driving force behind diabetes, obesity, heart disease, strokes, and fatty liver, and so on. Okay, so you can see there is one thing called insulin resistance, and that drives so many things, and that has caused so much of a burden on the healthcare and the general health of population, basically. So what happens is if somebody eats some amount of saturated fat, normally what happens is when we eat food, it gets broken down in the intestine, and when it is absorbed, it goes into the blood in the form of glucose. When it goes into the in the blood as glucose, so what happens is your pancreas, it produces insulin to bring the to utilize the glucose that is eaten. So what happens is insulin, it works on, say, for example, muscle cells. Okay, they will work on the muscle cells, and what it will do, it will open certain gates in the cell, and that cell, insulin primes the cell and glucose enters the cell and it's utilized in metabolization, okay, of the muscle cell. But when saturated fat is eaten, the insulin is not working on the muscle cell the way it should. So as a result, what happens is it won't utilize the glucose properly. It will keep on accumulating in the blood, And when it accumulates in the blood, your pancreas will pump more insulin to push back, put the glucose back in the cells, muscle cells again. It won't do. So this circle continues. As a result, the glucose keeps on building, pancreas keep on pumping more insulin, and as a result, it leads to a condition called, it can cause something we call glucose intolerance, like risk of diabetes, and it can progress to diabetes, and also the insulin resistance. So the good way to break this cycle is to eat food which is no or very less of saturated fat, more from plant-based and more whole food. So that's why it's so important.
Yes. Thank you so much for the wonderful explanation behind, how gut health and it basically the saturated fat, increased consumption of saturated fat leads to glucose intolerance, which is basically diabetes for those who are not into a medical field. So there is high risk of diabetes as well, and saturated
Yeah,
fat is something which is harmful for the heart as well. So it's all kind of
yeah,
the same diet goes for all the organs, for the well-being of all our organs.
exactly. Absolutely. Yes, yes, yeah, yeah.
There has been a lot of research and talks going on around a good gut microbiome and a good general overall health. So what are your thoughts about it?
Gut microbiome, I mean, it's not well understood understood concept actually, but I mean, and the research is still going on. Okay, and with improving technology we are getting more and more information. Okay, and every day new evidence is coming up, and it is more enlightening, I mean, and it's more eye opening actually, and we are getting to know more and more about gut microbiome. Now, for general population, what gut microbiome means, it's basically what happens is our gut, it has got good bacteria. Okay, it's not only our gut, actually we have got good bacteria in many parts. Okay, on our skin it starts right from the mouth and in the gut. So I mean, there is a population of good type of bacteria, and this good bacteria, it helps with many bodily functions. Okay, it helps with immunity, it helps with metabolism, and there are many other host of other factors. I am particularly talking about the microbiome which is in the gut. Okay, so basically there is a huge population of good bacteria which are there and which are required for normally bodily function. Okay, and it is required to maintain something we call homeostasis. Homeostasis, what it means, it's the normal physiology of maintaining a balance, a fine balance for optimum functioning of the body. So that's called homeostasis. Okay, so this gut microbiome is required for normal homeostasis. So what this, and the number of gut bacteria, it's in fact not only bacteria, but there are a few other organisms as well, few other microorganisms as well, and together they are called gut microbiome. The total number of them is far more than the total number of cells in our body, basically. And with its size, and because of the so excellent functions that it carries on, we have started to call this as a super organism, basically. Okay, because it is so helpful in our normal bodily function and the normal homeostasis. Okay, so this gut microbiome, it works for one's benefit, but when it is disturbed for whatever reason, then we call, the normal term is gut microbiome, and when it is disturbed we call it dysbiosis. That means this symbiosis means balance, and this, when it is disturbed, we call it dysbiosis. Okay, so the dysbiosis happens. When this dysbiosis happens, then it can cause wide variety of problems. In simple, from simple conditions like say bloating of the tummy, or some say mild discomfort and those sort of things, and it can lead to even things like cancers and things if this dysbiosis carries on for a long period of time. Okay, now this gut microbiome is quite unique. It is present right from birth, and it is there till end of life. Okay, and it is quite unique, and one should do their best to not to disturb it. I mean, there are certain events which can happen which are unavoidable, like any illness can affect it, and antibiotics are one of the very common commonly prescribed medications that can affect the gut microbiome. Okay, antibiotics, smoking, and depression. These all can affect the gut microbiome. Okay. So the key thing here is the diet. If one follows a good diet, then there are good chances that the gut microbiome will be kept in balance. And that when I say diet, it requires a good amount of fiber in the diet, basically. Because what happens is there are certain types of fibers which are not broken down in the small intestine. It goes into the large intestine. And there, what it will do, it will be broken down into something we call short chain fatty acid, okay, or SCFA. These SCFAs are very, very important because for normal metabolism. So they not only help with normal metabolism, they carry a very, very important role in normal immunity as well. So the gut microbiome is not only important for good metabolism, but also important for our for good immunity. So I will like to give you an example. Somebody who's trying to lose weight, they're obese, they have tried everything. Along with being obese or being overweight, they are having quite a few gut related symptoms as well. Okay. There is a possibility that they may be having dysbiosis, or the gut microbiome may have been altered, which is affecting their overall metabolism, and they are not able to lose weight. And that is causing some abdominal symptoms as well. Okay. Because these SCFAs, short chain fatty acids, they go into the bloodstream and they can affect if they are not produced in the right amount, or harmful types of fatty acids are produced, they can cause perpetual inflammation. It can cause the metabolism to go in the wrong direction, causing more accumulation of fat tissue in the body. So these things can happen. One of the other important function is it can affect, our gut. It requires a very, very good amount of integrity, because we eat, the food we eat, there is no guarantee that they are free of any harmful bacteria, harmful chemicals, harmful germs, and things like that. So during one's lifespan, on an average, say somebody is having average lifespan of say 70, 80 years, and throughout their lifespan, their intestines are processing at least 60 tons of food. Okay. So this food, that means all the time their intestine is exposed to some harmful thing or other, because it may be bacteria, it may be some other germs, it may be some chemicals or different things. Okay. They are called antigens, which is not unique to the body. It comes from outside, which has got a potential to cause problem. They are called antigens. So our intestines, they are exposed to antigens all the time. And this gut microbiome, it keeps those antigens in check. When they are not functioning properly, the integrity of the gut lining is broken down. As a result, what it can do is it can cause infections. It alters the permeability of the gut, so that it becomes very easy for things from the intestine to move into the body, or into the intestine and then into the body. Okay. Then it can trigger host of autoimmune conditions. Even it can lower the immunity. It can put people at risk of certain infections. Some people, they say that, oh, we are getting so frequent infections, so frequent colds, and so sore throats and things like that. That may be because their immunity is not great, and that can be related to dysbiosis. Now, these things were not we were not taking into account, say, if we had to go back 10 years back. Okay. But now with more information, we are becoming more and more aware of it, and we have started paying attention on how to protect the gut microbiome. How to protect is through with the help of a good nutrition, which again comes to our nutrition section, where I mentioned that less of refined food, less of oil, less of fat, more of fiber. Yogurt, things like anything fermented is quite good usually. Okay. So things like yogurt is very good. Okay. Probiotics nowadays are easily available in commercially. So probiotics are also good for healthy gut microbiome. Okay. And not only this, it can cause mental health issues as well, depression, and there are many other things, mental health issues it can cause. So it is playing a big role in your normal homeostasis, normal bodily functions, basically. Otherwise, it puts you at risk of certain diseases.
That's a very good explanation. Sir, so I think everyone should know about gut microbiome and about dysbiosis, and I'll try to, educate the people over here more around the same topics. Like I'll try to, cover gut health as the topic in my content on my social media pages as well, because I think people are so unaware. Like even
Yeah.
myself, I know all these things, but I never thought of, putting this up there and, explaining it to the normal public. I just explain it to people who come with those specific symptoms. So
Yes.
I think this is going to be really helpful for everyone, sir. Thank you so
I
much.
mean, no, you're very welcome. I mean, what I feel is, I think it's time now because we are getting so specialized. Every part of medicine is becoming more and more specialized. Okay, so medicine, when initially, say, if you go back, say, 50 years or 60 years back, then I mean, it used to be like general medicine, but then it branched itself into subspecialties. Now, even in subspecialties, say, for example, I'm in gastroenterology, but it has got branched into hepatology, which is science of liver, study of liver, and then hepatology again has got its own branches and subdivisions. Okay, I think it's time that we consider the person as a whole, basically. Okay, and there has to be a very good cooperation between various specialties, various specialists. Okay, need to take the person as a whole rather than treating, say, if somebody comes to me with a gut related problems, I treat the gut part only. And but there has to be a very good, needs to be very good cooperation between the various specialties. And secondly, the person needs to be taken as a whole, and they need to be educated with the fact that the gut problem may be just tip of the iceberg. It may be related to many other things that may be going on elsewhere. Okay, so I think that is the most important part, and I think lifestyle medicine is where it will help in getting putting the person, the whole perspective in the picture, and treating the person as a whole.
Yes, that's very. This is very true, because everything is interrelated, and we cannot just concentrate on one aspect. Especially when, like you said, it's just the tip of the iceberg, and then we are able to diagnose all these conditions like at such a later stage when it's obviously difficult to reverse and easier to prevent in the first place.
Yeah,
So this
true.
is very helpful for everyone. So thank you so much, and I
No,
think
thank you.
covered like all the areas basically which I wanted you to, and I don't even need to ask you to, give us some takeaway tips because you have already done that in all your answers. So thank you so much, sir. And it is actually so, I feel so good to, to see you working into this field, to see people like you, um, like you are a gastroenterologist, and if people believe what you say, right, people are not going to believe anything about health, anything about gut health, which comes from a person who is not
Yes.
practicing, like who is not specialized in gut health basically. So your word is what makes more of a difference, and it's really so good to, see you practicing lifestyle medicine and helping so many people. So
Thank you. Thank you. And in fact, I mean, that's what I also thought. I mean, I felt that I need more than what I am already doing, basically. Some extra expertise I need to deal with the problems we are seeing on a day-to-day basis. And it won't be right for us to just keep on treating and not address what's going behind the scenes, basically. And I think we are not doing any justice to healthcare if we are just treating the symptoms and not paying attention to what's going upstream, basically. Okay, so I think we should all do our part to see how these things can be prevented. And I think preventive aspect is going to play more role in the future, which is going to help improve the health of the population and the health outcomes, basically, isn't it?
yes, sir, very true. For prevention also, and even like for the patients who already have any, any pre-existing symptoms, if they are aware, if they know what is to be done to prevent, they can at least decrease the severity of the symptoms, and especially in cases of surgeries and all bariatric surgeries or any other
Yeah,
invasive surgeries, they can be prevented or at least delayed if the
absolutely.
patients are aware, right?
Absolutely. Absolutely. Yeah.
So
Yeah.
thank you so much, sir. I think
No,
we
you are very welcome. It was a pleasure, and thank you for giving me the opportunity to be part of your part of the conversation, basically, and part of what you are doing.
Thank you so much, sir. This is just something on a small scale that I'm doing, but hopefully we'll be able to reach more people
Yes.
with support from such great personalities like you. So I was very happy to
Well, that's very kind of you. So I'm a very humble person, basically.
yes, I know that. So thank you so much, sir, again, and thank you for all your guidance as well, always for your support and for doing this. And I would definitely love to cover some more topics in the future whenever we can coordinate a time. And so
Absolutely. I think, I mean, I will be happy to cover quite a few things. And because what I have discussed is basically a broad idea of what's going on. And each topic in itself that we have discussed today, like, say, fatty liver or irritable bowel syndrome or anything, they by themselves merit discussion, a big discussion, basically. Okay. So I think, yeah, we can do more sessions in the future. Yeah, that will be good.
definitely.
Nice to see you, Roma.
Thank you.
You take care.
See you too, sir. Thank you so
Take
much.
care. Bye bye.
Bye, sir.